Yes, so in this analysis we looked at patients from the BIOSOLVE-II series of trial in which patients became or had OCT at baseline and also at 3 years follow-up. And this was a total of 21 patients which we identified, and we really looked at each frame in these patients within the OCT pullback, each 0.2 millimeters, and also took each quadrant of this frame and assigned a certain score whether they had diseased or non-diseased quadrants. In total, we looked at more than 2,000 frames with more than 8,000 quadrants at both baseline as well as follow-up. So when we looked at the results, basically we looked at overall regression versus progression of disease based on a relatively arbitrary threshold of 5% regression or progression. And we identified 5 cases which showed overall regression of disease and a total of 13 cases that showed stable disease, meaning less than 5% regression or progression over time over the 3 years. Yeah, so we had previously shown in a preclinical analysis that Magmaris scaffolds seem to reduce neointimal macrophages as a sign of neoatherosclerosis. This is why we intended also to look into the clinical data set and see if we see any signals of reduced neoatherosclerosis formation. And along these lines, we found that there is obviously stable disease, and some patients even showed regression of atherosclerosis over time. So a very strong signal to confirm the preclinical data. So for now, this is based on a retrospective analysis. I believe we need future randomized prospective trials to confirm this data, but if confirmed, I think this is a very good signal, because that would mean that Magmaris bioresorbable scaffolds would really reduce neoatherosclerosis, so a really good signal for the future of our patients.